Good afternoon, my name is Catherine Tyler Carley. I'm a current student enrolled at Jeff State in the PTA program class of 2020. Today I'm going to be talking about anemia and B12 and how it relates to physical therapy. So first off, what I want to do, I want to start it with what is anemia. Anemia develops when your blood doesn't have enough red blood cells or hemoglobin, which is the main part of the red blood cells that binds with oxygen. Anemia affects about 3.5 million Americans. Anemia is the most common blood condition in the United States. It mainly affects women and children, especially women who are pregnant. So there's more than 4 types of anemia, but what I've done is I've divided it into 3 groups. So you have anemia caused by blood loss. You also have anemia that's caused by the decreased red blood cell production, and then you have destruction of red blood cells. Okay. Also, the most common form of anemia is iron deficiency anemia, which is the main one that I'll be talking about. It happens when you don't have enough iron circulating through your blood. Treatment for this is like iron tablets, prescription iron tablets. In order to be diagnosed, you do have to be blood tested with a lab work, like a whole lab value workup. There's also vitamin deficiency anemia, is the lack of amounts of certain vitamins, including folate, vitamin B12, and vitamin C. Folic acid and B12 are the main supplements given for the second group. There's also aplastic anemia, hemolytic anemia, and sickle cell anemia. Okay. Anemia is not a disease, it's just a condition. Most people don't realize that they have anemia. Your main symptoms normally is excessive tiredness, the feeling of being cold. Severe diseases can cause anemia, such as heart attack, cancer, and kidney problems. That's mainly why I've focused on this. Just because being at my last clinical, I was mainly on a cardiac unit, and we did see a lot of anemia coming from as a comorbidity to a heart attack, or whenever patients underwent cabbages and heart caths placements, most of the time in their file it would be a quote comorbidity with anemia. So that's why I chose this subject. Also, we can get into treatment options. So a medicine that can be used to help anemia is B12 and iron supplements. Like I stated before, any of these supplements, they don't cure anemia. It's just to sublimate the symptoms, which is your shortness of breath, your tiredness. And as far as physical therapy goes, what you want to do, you really want to encourage pacing, teaching your patient how to pace themselves for activities, and then also teaching them energy conservation techniques. Specifically, like what I worked with was with patients who just went heart surgeries. So not only are you teaching them to pace themselves with their heart surgery, but you also need to keep in mind that since they do have or could have anemia as a comorbidity, they'll be more tired, they'll be out of breath more. So if you're ever gait training, you really need to focus on pacing themselves. For example, like set a goal to walk 50 feet, take a standing or sitting rest break, whichever the patient may require. It just depends really on the person. Also, bed mobility really tires patients out. So with anemia causing extreme tiredness and shortness of breath, bed mobility can be very difficult at first, especially if they're recently status post from a surgery. That really needs to be addressed with breathing techniques, Also, if you sit at the edge of the bed for dynamic sitting, along with dynamic standing, any exercises like that, you really need to focus on teaching your patient breathing techniques, pursed lips breathing, in through the nose, out through the mouth. You can also include helping them open up their chest to take deeper breaths to get more oxygen in so they don't feel so short of breath. And then going back with the medicine, what exactly does vitamin B12 do for your patient? It helps make DNA in all cells. It also keeps blood cells healthy. So that's why it's used to treat anemia, just because it protects the cell in general. B12 is also considered an energy booster, which helps them regain the energy that they have lost due to anemia. B12 is not produced by the human body. It's accumulated strictly by your diet. So encouraging good eating habits. We can't, as as PTAs, we're not able to talk about medications or any of the sort, no recommendations for medications, but you can educate them about food, what is good, such as spinach contains iron that helps, along with just vegetables. There's a lot of B12 based foods that you can get. And due to the B12 not being made by your body, it doesn't store as long, so it really burns off quickly. B12 also helps maintain nerve cells and the myelin sheath, which is great to speed up and help recovery process, which a person might go through in their lifetime. So for instance, if they're taking B12 and just underwent a surgery, whether it be an orthotic surgery or a heart surgery, B12, because of its relation with the myelin sheath of nerves and just the blood cells in general, it helps speed their recovery because it'll help make and protect the red blood cells that anemia can result from. I do have a list of foods that are B12 enriched. So you got like shellfish, liver, soy products, red meats, some cereals, and like low-fat milk is really good that has B12 in it. Okay, and lastly, I want to talk about cyanocobalamin. It's the man-made form of vitamin B12. As you can see in this picture, this is the shape of basically the simple chemical breakdown of it. This is a chemical picture. This is the picture of its chemical makeup. And then I have my works cited page right here. But overall, just encourage I encourage you to chart review and know your patients strongly before going in for your treatment, especially with surgeries in elderly patients if they're female as well, just because they could have anemia and that could be the cause of their shortness of breath, their tiredness, and other issues like that. Thank you.